Pain in the head is quite common. It is a little bit like an electrical circuit where you turn the switch on and the current goes up to turn on the light. You may experience pain in the front of the head, the side of the head, as in a headache, or ear symptoms such as earache or ringing in the ear, or you may get pain in the cheek region, and it may be difficult with mouth opening. If the pain signal is big enough, then this will turn the switch on to the nerve that supplies your face, and the pain signal will then go along that nerve to the spinal cord, where it will cross over to the other side, and then the pain impulse will go up the brain to the pain center in the brain, where it will be processed, and the brain will then take action. So if the pain signal arises from the face, it will be sent along the nerve that supplies the face, shown here in a red arrow, to the spinal cord, where it will cross over to the other side and go up to the brain. At the same time, the brain will try to stop the pain by sending an inhibitory signal, which is shown here in green, to stop the pain. If the red signal going up to the brain is greater than the green signal going to stop the pain, then you have a resultant pain, and you will feel pain in the area where the pain originated from. Nerves are like a set of electrical wires, where at one end you have a switch, and here the switch is shown like tentacles, and it's chemicals produced by the body that turn this switch on, and then the signal will go along the nerve fiber to the nerve body. Here, the nerve may pass the message on to another nerve, again through those tentacles, and again it's chemicals that are used to pass that message on, and so the message may carry on the other nerve, for example in the spinal cord. So in summary, pain may originate at number 1, which is at the surface. This could be through trauma or infection. And at number 2, this pain will then be sent along the nerve fiber as an impulse. And if you follow the arrows, it gets to number 3, where in the brain that information is processed. And depending on that processing, then the brain will take action, which is number 4. This process generally occurs as a result of, as mentioned before, infection or injury. And once that infection or injury resolves, the pain should normally resolve. And that is the normal process of how nerves work. If the pain is there for more than 3 months, then we know that there are changes that occur in this pain process. And what happens is that you get overproduction of those chemical switches, and so the processing of the pain in the pain center becomes abnormal, and you get ongoing pain. This is called sensitization, and in this situation, the pain behavior becomes different. So when pain becomes abnormal, then it becomes very difficult to try and manage that. It doesn't respond to the normal treatment that you would get in a pain situation. Say for a headache, you might take Panadol and the pain goes away. In this situation, the abnormality means that you need to have other methods of trying to help that pain go away. For example, like in this car, the car's had an accident, it's got some damage, and so it's not going to drive as well. So in the situation of trying to fix that, we have certain tools that we might use, and we slowly start to rebuild the car. In that same way, we have some tools that may help us with trying to reduce that sensitization in the brain, and these may involve some self-help things that we can tell you about that you can do at home. And these may be things like meditation, thinking positively, where what you're trying to do with that is to activate different areas of the brain, so creating a distraction away from that sensitized pain area. Sometimes you may be able to use physiotherapy. Sometimes we may be able to, in certain pain situations, make you an appliance that you wear, depending on what the pain problem is. And sometimes we use medications that are specifically targeting those chemical switches, the overproduced chemicals, to try and switch them off. And then with time, the body will regenerate that to a more normal situation and your pain will start to subside. So in this way, you have to have a lot of patience, just like the car may take a while in the garage to be fixed up. Your pain may take a while, and together we can take that pathway and get to a good resolution. And the good thing is that majority of people with this kind of problem do come right or get reduced pain. So in summarizing your chronic pain occurs if your pain has been there for more than 3 months. This means that the nerves become overactive and overproduce the chemical switches that turn on the nerves, and therefore the nerves will now act continuously and the whole process within the brain is abnormal. Normal painkillers do not work for this problem, but we can successfully use medication that work on the nerves specifically. There are things you can do at home that may also help, but the whole process can take a lot of time, and majority of patients do improve, so that is good news. We are here to guide you through that path. And as you see here in this brain that is lit up, you take medications that are specifically targeted towards calming those nerves, and then you are left with a brain that is back to normal again.